medical lead of the MSK services in the NHS there, and he is very active in many organizations. He is a member of many committees and boards in the British Society of Pediatric Radiology, European Society of Pediatric Radiology, and International Skeletal Society. I think that I remember most the important ones. So anyway, he will share his MSK knowledge with you tomorrow, but today he will talk to you about working and being a consultant in UK.
Thank you very much, Dr. Joanna Brown, and I hope you all hear me very well. So I will start by going through how to be and what is the good thing about working as a consultant in radiologist in UK. And I'm presenting this talk as in a capacity of the RCR Global Committee, as a member of the RCR Global Committee. So the outlines of my presentation will include, can I work as a consultant in UK as an overseas radiologist? How can I do that? What are the different routes or pathways, which you already mentioned some of them by my colleagues in the panel, and would my previous training and experience be recognized? I can answer the first question, can I work as a consultant? Yes, of course you can. All of us can work. So this is easy. This is one done. So this is me. This was 25 years ago. I was an aspiring radiology registrar in Alexandria University, who also is training in Alexandria, may recognize some of the faces, but at that time I was aspiring radiologist, want to find my way into radiology and MSK specialty. So let's start by saying some of the overseas radiologists think or find the system, the UK system is confusing. Actually, in my opinion, it is more of being flexible, because there is no just one way you can get into the system and work as a consultant radiologist or a radiologist. There is different ways to do that. And as you already mentioned, there is the different ways that we're going through and mentioned by my colleagues in the panel. So I don't think it's confusing. It's actually can fit for different needs and different previous experience. My story or my experience might be different than yours, but it can be also helpful and a guide. So before deciding working as a consultant or a radiologist in UK, you have to ask yourself, or set this, in my opinion, set goals. Determine your goal, get registration with GMC, find a suitable job, obtain your work visa, and start work. Easy, straightforward. That's what you expect. But sometimes there is some difference. You can get the registration with GMC registration and find a suitable job. At some time you can combine these two by just applying, and when you get the job, you can get the registration. Or also you can swap. You start by finding a job, then if the hospital is willing to support you to get your GMC registration, so you can start by 3 and get 2. So this is basically what you need to do, the 5 steps that you need to do. But what I always find, especially here in this country, the question that always, people don't ask themselves why I want to go there in the first place. I find the feeling is more people want to leave the country rather than going to UK, but you need to think carefully why you want to go to UK. So think, all of you young radiologists, before I proceed, why you want to go to UK, okay? Then decide which best route for you. So broadly speaking, there is 3 categories you can, or positions or roles that can do enroll in UK as a radiologist. You can work as a consultant radiologist, of course, having a permanent substantive job, and then you can stay there long term and make UK is your country as a country of residence. Or you can decide, I'm going to go work as a radiologist, but not necessarily as a consultant. Or you can, decide I'm going to have a subspecialty training then decide whether I want to continue in UK or just go back home. And by the way, 2 or 3 can end by going back to 1. So this is what I'm talking about, flexibility of the system. So just to convince you how beautiful and how great to be a consultant in UK, this is one of the decisions I don't think I regret. Actually, I think this is one of my best career decisions to come and work as a consultant in UK. I will just show you the downside is the salary. You can see the salary in UK is not one of the best compared to the European and North American. You can see it is, this is 2009 statistics, but it still apply. But on the other hand, you get lots of support and career progression. You get something called professional activities included in your plan. You get a general study and annual leave. In average, you can have up to 10 weeks of annual leave or of leave in a year. So you're working actually 42 or 41.5 weeks per year. You can get lots of opportunity to have CPD. Easy to find a job once you are registered and you qualified consultant because of the shortage. You can find a job. You can always develop your subspecialty training. So you don't have to practice or forced to practice as a general radiologist. You can do a subspecialty practice where you are comfortable with. And of course, if you stay there for a long time, there is a very generous pension scheme. So it is nice, it's good to work as a consultant in UK. And this is just one of the last census that was published on the RCR website that we need, UK need more than 22,000 more radiologists. So lots of work to do. So the other good thing is the opportunity you get as a consultant working in the NHS in UK. You get all the support to get CPD in your plan. There's lots of opportunity to do research, attend conferences, improving your skill and practice. There's all meetings that improve your communication skills, whether it's consultant meetings, multidisciplinary meetings where you discuss cases, help you and improve your experience and education. And of course, every 5 years, you have to do revalidation through frequent annual appraisal, where you can discuss your career progression, help you to improve your service that you apply for the patients and for yourself, and you can progress. And you can, the other thing is also is the other roles you can do as a consultant. And you can see all these roles as whether it's educational or management roles, and you can do it as early on in your career. You don't have like this in Egypt, for example, you have to be an experienced radiologist, 20 or 30 years to have a management role or educational role. You can actually do it from day one if you wish to do that, and there's opportunity for that. And you can get the RCR support, which Mrs. Tanya Van Buren already explained. You get lots of support from the RCR. So you feel supported as a consultant. You're not by yourself. There's a lot of institution and your hospital is supporting you. So the question, do I need GMC registration? Yes, of course. And you can do that by this routes, the AFROSAFE, the MTI sponsorship, which was mentioned. And of course, you need to provide that you can understand and speak English fluently by passing the test, either the IELTS or OET. And this is how we do the process. It's a straightforward process. All you need to go to the GMC website and have an account, then send the required application that it's asked from you. So if you just go and describe every single goal or decision if you want, can I work as a UK consultant radiologist? The answer, we said yes. And this is the 3 different routes, either through the completion, CCT, the completion of training, which was already discussed in details by Prof. Gita, or you can combine, have a CSER, or a certificate of equivalence, or you can combine a bit of both. which is already mentioned as getting entry to the training as a third-year registrar. So this is the three main routes. So I would not go into these details because it was already this mentioned in the first presentation, but this is the main route, way to be a consultant through the CC route, and this is explain how you can do that. The only thing you need to know as an overseas consultant, if you overseas radiologist, if you have more than 18 months of experience, this is not the job for you. This is not the route for you. And actually, if you start applying, most of the time they will think this is for ST1, you are overqualified and probably you will not get it, okay? So if you have more than 18 months, this might be not the best way for you to get into the UK system. And it is difficult, of course. And you can see in the most recent statistics, only of 9% of radiology trainee who was qualified overseas and had their training overseas can get into the system. Most of the people who can, they can just need to join the system from scratch. The other route, which was mentioned, Caesar route, which is those suitable for people who have 3 or more of previous UK overseas experience, and this can be done by applying directly to the JMC. The other name of this route is called Article 14. We call it Caesar, which stands for Certificate of Eligibility of Specialist Registration. It is a long process, but it is what you call a robust process. I sit in the panel of the Caesar panel, and it is a really robust process. Normally, in average, to get an approval, it takes around from 12 to 18 months. But the success rate of most of the overseas radiologists is over 80%. So you have 80% chance to get through this route if you are trained more than 4 years in your home country. The other route is the combination of Caesar and CP route, which probably this will apply for the getting entry to the third year, because in the previous rules or guidelines that if you have if you spend less than 3 or 4 years in a UK training scheme, you will probably get a Caesar. But I think this is changing, probably will change, and maybe Tanya and Mr. Van Buren can correct me on that, because I think they are changing this rule, and even if you get into the training scheme as a year 3, still you will get a CCT. Yeah, so I think this will be soon recognized as CCT. Okay, but having said that, whether you get CCT, Caesar, CP, or Caesar, all 3 routes, you will be recognized as consultant. In practice, there is no difference whatsoever between them. Whether you have a CCT or Caesar and working in a consultant, you will be as any radiologist working there. They will have the same opportunity and same career progression. I personally have a Caesar. The way I got into the system by having Caesar, and I don't think this has stopped me from doing anything by involving the RCR nationally or internationally. It is exactly the same, or even getting a management role or education role as education supervisor in my hospital. No difference whatsoever in real in practice. But the only thing that you need to know, it might be different when you want to leave UK and work in somewhere else. I heard, not sure about this information, if you want to move to Canada, they will not recognize the Caesar, and you have to go through the whole process again. So for me, it doesn't matter because I'm not planning to go to Canada, but anyway, and I'm not sure to do that. So this is the only thing that you need to know. If you want, Caesar might be different if you want if you want to decide that you immigrate to another country. So goal 2 is you just work there as not a consultant by just doing locums or just going a fellow, then you decide to go back to your country, or just continue as doing locums and non-subsistence drugs. So you don't have to be a consultant there. But if you decide at some point that I want to be a consultant, you can do that. And that's what I call the flexibility, because you can do it through Caesar again, okay? The other goal is just, you don't want to get a consultant job whatsoever, you want to just have a subspecialty training. Then you can decide whether you can, again, stay and decide later, or maybe go back home and work as a consultant home. And this can be directly done by two routes, either by applying directly to the specialist fellowship, okay, go online, identify your interest, and I'll apply for the MSK fellowship. But the thing is, it is really, really competitive, this kind of fellowship. It is, you can get it, but it is really competitive. The other route is the global fellow, which was mentioned earlier, okay? And this is what you need to apply to be a global fellow. I think it is on hold at the moment because there's no job, but we're in the process of finding more, activating it, okay? At the moment, from our side, we appointed 2 Egyptian radiologists in Wales and 2 in my department in Oxford, and it was very good success story. Sorry, I'm running a bit late. And this is the process of Global Fellow, which we can, at some point, go through it in details later. And it's open to all overseas radiologists. And after you work there, just be careful that you have to abide with the good medical practice in UK, either with your colleagues or with your patient, and you have to treat all patients the same once you are a radiologist there. And this is just for further information how to work as a consultant in UK. You can log into this website, whether the BIR or directly on the RCR website. And in summary, you need to set your goals. There are several routes that fit your needs or your previous experience. Always do your own search, ask friends, be patient. I always get asked, when is the best time to come to UK, now or later after I do my things? Actually, always my response, keep knocking all doors, and when one of the doors open, this is when you know this is your right time. Okay? And make sure when the door open, it fits you and your loved ones. So come with your loved ones and your family. So it's fit for all of you. And hard work. Just do hard work. And this is me now, after 25 years, working as a consultant and enjoying being active with the RCR. Thank you very much.
Thank you so much, dear Ramy. As Dr. Joanna said, we will have 10 minutes after the next talk for discussion. So